Hello and welcome. I'm Jade Scott. This is GrowthRx, and today we are joined all the way from Queensland in Australia with the beautiful Garima Bharti. How are you, Garima?
I'm great. How are you, Jade?
Good. Thanks for joining me here. We're talking about one of my favourite topics, which we're going to deep dive into non-clinical and soft skills. And I love how passionate you have been behind the scenes for this for us. I'm just going to make sure that we are in the group. Hello to everybody who is watching on this. Oh, it's a bit dismal this Thursday. What's the weather like for you up there in Queensland?
It's raining as well, but I must say I don't actually link it to being dismal because in India rains are actually awesome. So I love it.
Well, it's combined with that tropical sort of nice humidity, isn't it? Gosh.
Yeah.
Oh, you're making me think of holidays right now. I would kill for a holiday now that we can get back open and get back on planes.
I agree.
Now, you are a physiotherapist, obviously, but you are a dedicated and passionate mentor. You have your own practice as well, but you're also a lecturer at the University of Queensland. What does a normal day in the life of Garima look like?
Oh gosh, wow. Should I do the long version or the short version, Jade? I mean, you're a mother, so you would know how busy the mornings can get.
Yep.
So yeah, absolutely hectic in the mornings until I get to work, and then I can do a little bit of work. So most of my work happens between, I'd say, 9 o'clock to 3 o'clock, and then after 7 o'clock, once my toddler goes to sleep. But yeah, basically just getting into the business, getting stuff ready for my little toddler, and then chatting with amazing people like you.
Well, I'm really looking forward to what you've got planned for us today. I know you've been working really hard behind the scenes on some slides to present because you are very, very passionate about this. And you are, I guess I would say I admire you for your courage and vulnerability when you're talking about your experiences in private practice and as a woman in business, which I love, which kind of leads me to, a question that I love asking a lot of our guests. What does leadership mean to you?
Yeah. So leadership for me now means serving people. So it means serving my team, it means serving my customers, and just providing more value.
Yeah, look, couldn't have said it any perfectly myself. And there is a wonderful YouTube link out there, and I'm familiarizing you here with the wonderful Oprah Winfrey, who has an amazing talk on service and significance particularly when it comes to leadership, which I do present in my leadership courses. So, you couldn't have said it any more beautifully. It is, and service makes other people matter, and in return we matter to them. So it's great. Now you are very passionate about this non-clinical and soft skills approach in private practice, and I think more so you've been investing into this over the last few years. What's made you shift across? I guess, I mean, obviously I've got the course in Good to Great in Private Practice, which is the foundations of soft skills. So I am totally with you on the importance of needing this.
Sorry, Jade, you're breaking up there.
Sorry. Am I back?
Okay.
I'm back. The joys of going live.
Yes, you are back.
I talk too much. Maybe that's the universe telling me.
That's okay.
But look, I am very passionate. Good to Great in Private Practice is very much off the foundations of these soft skills. And there are a lot of people that use this in private practice, but probably don't invest into it as a focus. When did and you'll tell us a little bit more in your presentation, but when did your passion for the non-clinical side of private practice start in regards to teaching and mentoring this space?
Yeah. I think it was actually one of the gifts of COVID too, but it was just through my own struggles as a new mom and being a health professional. I wasn't able to diagnose this myself. So I had postnatal anxiety issues, which got escalated after a family tragedy, really. And this it shifted priorities for me. It just made relationships very important to me, and more so the relationship of my team, because I don't have any other family besides my husband and of course my daughter now. So we don't have any other family in Australia. So relationships just became really important. And I just started exploring. I started, reading more and just really understanding how I can connect with my team better. And funnily enough, I could actually translate that into my relationship with my patients. So, and then I thought, okay, well, let me just ask my team to perhaps try the same, questions or different way of asking the same questions to the patients. And that worked. And I thought, okay, well, something, there's something here. You can't just be about subjective, objective treatment plan. There's just more to this. There's a connection that happens between you and your patient. When that patient first walks into the room, in that initial consult is when your connection happens. And there's more to it than just clinical expertise. And yeah, this just made me, become a bit more passionate about the non-clinical mentoring.
I couldn't resonate with that more. We talk often about finding the emotional event and treating, obviously, very much more than just the condition. You need to connect, build trust, build rapport with that patient, particularly in such a disposable world where people are making decisions and swiping left on Tinder and replacing things constantly. We're in a very, very fast-paced world, and connections are what ties us. And it also ties back to your definition of leadership, which is service, which I love so much. So tying all these things in is just really beautiful. And I think, from me personally, and I don't have any qualitative analysis on this, but I would say connections is 80% of what we do in the room, and the remaining is our technical skills, our hands-on skills, and formulating treatment plans. But we don't even get a chance to do that unless we've connected with the patient first. So
for sure.
I cannot wait to hear what you've got to present to us, the 5 common non-clinical mistakes that practitioners make. So I'm going to hand over to you and allow you to screen share, because I have seen these slides. And so I'm really excited about actually highlighting the focus and making these very, very valid points in clinical practice. So over to you, Garima.
Thank you, Jade. Only once I can figure out how to move on to the next slide, I'll be great. So let me see.
Just click your mouse.
There we go. Obviously, I'm not that tech savvy, guys. So please, thank you for your patience. Bear with me. I do want to start with my story. I know I've already spoken about how I got into clinical mentoring, but I came to Australia from India in 2006 to become an Aussie physio. So after about a grueling year and a half, finally acquired my license in 2008, and I was able to work. So I worked for other people until 2012, actually. So while I was working for other people, I realized that I really had more to give, right? So especially in terms of customer service, this was really important to me to provide value to my patients. And I really didn't think we were achieving that in the practices where I worked. So finally founded Get Better Physio in 2012. And I've already I've spoken about non-clinical mentoring and what got me into it. But I also did a coaching certification program, which actually helped me to apply these learnings to both patient care as well as my team. And that was really the start of it all. So let's get into it. Now, before I start with mistake number 1, I would like to present this quote from James Clear. He's written an amazing book called Atomic Habits. If you do get a chance to read it, please do. The world rewards you for value provided, not time spent. And I just feel that a lot of health professionals actually charge for the time spent. So here's something to think about rather than, providing value. So mistake number 1. Thinking that your professional life is different to your personal life. Now, why do I think this is a mistake? Look, we go to uni for what, 4 years? Sometimes 5 if you've done a bachelor's degree and then you're doing a master's, and you're just taught to be a professional, right? You're taught to be a professional person, and this can almost, in your head, you can just become you can have a different persona in front of the patient, sometimes without even realizing it. Most of the times, though, I do think it's a very conscious effort, because you want to be this know-it-all personality in front of the patient. This may come across as ego to the patient. And I do feel that it can create a barrier between just getting to know that patient a bit more. So it's really important for me that, I actually get down to the same level as the patient, and just, even though, you can give them a medical term, it's very important to actually get down to their level, explain in really common terms what the issue is, but also show emotion, show empathy. You can even show sympathy, and try to give some examples from your life in order to connect to the patient. Would you actually put on that professional armor, so to speak, if you were talking to a friend? If your friend came to you for treatment? No, right? The way you ask the questions would be very different. It would be a conversation rather than, oh, a professional person sitting here and the patient sitting there, and you're just asking very clinical questions. I'll actually give you an example here of a specialist. And as we know, specialists, they give you 5 minutes if you're lucky. So I had gone with my husband to meet the specialist, and I obviously had a question. I do think stress affects a lot of different health conditions, and the specialist was focused on my husband. He did not even give me a second glance, but I just asked him, is stress is stress a factor here? And he just looked at me and looked back to my husband. He said no, and then he just went on. Now, would you be surprised if I said I did not go back to that specialist? Probably not, hey? So I do think it's just very important to get down to the level of your patients and just address, just try to connect with that patient by giving examples from your life, by showing emotion, by showing empathy. Yeah. And that brings me to mistake number 2. Now, are you treating a condition or a person? Okay, this is especially true. Now, I will target the newer physios here, because I do think it's, newer physios tend to get so lost in getting to a medical diagnosis. They want to know what's the term that we use for this condition before they even begin treatment. And sometimes that is not perceived well with the patient. So, people come with it. This is especially true for people with chronic pain. They're coming to you with so much emotional baggage, right? All they want to do is just to be heard. Sometimes they even just want a validation from you that, oh, I waited this long to come and get treatment. Was it okay? They don't want a health professional to go and tell them, oh, you did something wrong. You should have come to me 2 years ago, or whatever it may be. So if you go in with just an attitude of serving them, so just to understand, look, I am treating a person here. The person has had emotional baggage, right? I'm just going to try to get to one thing, try to get to one thing in this session that the person wants to achieve. And that's the attitude of serving. So don't just go in with diagnosing a condition, because yeah, you'll feel great about it after, but did you serve the patient, right? Give you another example of this patient that I'm currently treating, actually. And she gave me a whole list of surgeries that she's had, actually. So she suffers from chronic back pain too, and she has had all these other surgeries that have affected her condition. And she went to two other she went to two other physios. And, she kept telling them, look, this exercise hurts. But they just said, look, there's evidence for it. And this is the exercise you need to do for this condition. And, maybe not in the same tone as I'm telling you, but basically the patient did not feel heard, right? When she came to me, she actually said, well, oh, this is quite refreshing. You're actually sitting there and listening to what sort of symptoms I get after I do the exercises. Or she's also currently seeing a chiro. So she was quite surprised that I was so open to how the chiro was helping her. It wasn't just about how the physio or what I can do for her, right? So I think that just being heard was just very important to her. Hey, Jade, please let me know if I'm going over time, but
no, you're all good. All good.
All right. And that brings me to mistake number 3. Now, this is a little bit of a favorite one for me. Are you judging your patients? Okay, so are you judging them by how they present, by which health professional they may have seen, whether they believe in acupuncture or they see a chiro? Tell me something actually. What would you say? How do you respond when people ask you, oh, is a chiro better? Or is a physio better? Or what's the difference between chiro and physio? That's my favorite one. I'm not sure if you've had a lot of those questions as well, Jade. Now they do ask about osteopathy as well. Well, what's the difference, right? So be prepared. Be prepared for those answers as well. But the most important thing that I really think health professionals don't know how to address is, how do you respond to someone when they say they have anxiety or depression? And I've done this in my previous years of working as a health professional. I sort of, I just say, oh, okay, you're taking medication, okay. And then I used to just go over and start asking other questions. Look, mental health issues are so hard to talk about any which way, right? Mostly the person will talk to you about mental health issues when they've overcome it. It's very hard to talk about it when they are going through it. Okay, so if in a one-on-one setting, the patient has trusted you enough to give you a bit more information about what they're going through, you need to listen. You need to observe their mannerisms. You need to learn from what they are telling you about how stress affects their pain levels, right? You also need to open your mind to other therapies. And I'm not sure what is it about health professionals, probably just because we study so much and, we believe in our therapies so much. But, I mean, people will go and see mindfulness experts, or people will see health coaches, people will see nutritionists. So it's not just a job of one person to cure them of all their emotional baggage, like I said before. So it's very important to actually collaborate with other health professionals. Why? Because the end goal here is to actually serve that patient, right? We want the best outcome for that patient. I mean, God knows the number of chiros and even physios I've tried to call in the past year, but it's just, people don't get back to you. And, they think they don't have the time, but come on, what's the end goal? The end goal is to provide the best care for the patient. And I firmly believe that you can't do it alone. You do need other health professionals to come in or collaborate in order to achieve, or in order to, provide a great value for your patients. I do have a little study here, actually. So this is because there's so many health coaches now. A lot of people probably don't even understand what they do. But it was interesting, while I was doing my research, I came across this little study in the Journal of Psychosomatic Research. And it actually spoke about, mindfulness-based stress reduction, especially for arthritic or chronic pain. And, there were massive improvements. And this really made me focus on contacting health coaches and trying to understand, okay, what is it that you do that helps or that could add value to my patients? So just as an example. Okay, I'll move on to the next mistake. And this one is about your relationship with your mentor will actually affect how you treat. I see a few people raising eyebrows here, so hear me out and then you can let me know what you think. I really think that, and it's not about pouring your heart out, right? It's not about telling them everything about your life, but it is important to be honest about your goal and how this particular job that you're in is helping you achieve your goal in life. And please don't say a cliched answer like, I got into this because I wanted to help people. I'll tell you, all of us did, right? All the other health professionals did. But what is your why? What is your vision for your life? And how can your mentor help you achieve it? Because unless you're honest about it, your mentor is not going to be able to tailor make, your mentoring session, so to speak, for you. Being honest about your feelings actually will result in better job satisfaction, right? And this will in turn result in better patient outcomes. It will reflect in your relationship with your patient, because there are only certain things that you can do, right? For chronic back pain, chronic neck pain, you hit a ceiling, right? But as soon as you start talking about these non-clinical things, every patient will present differently. And this will in fact add quite a bit of spice actually in your mentoring sessions, because it's not just about clinical stuff. It's about how that patient presented, why a particular patient responded well to treatment with respect, as compared to another patient who may not have responded with the same condition. There's, again, I'm going to bring up mental health issues here because again, this is something that is not spoken about, and perhaps business owners or mentors may not know how to respond as well. But it is important to be brave and just let them know what is it that that you may be suffering from. And this will at least then open up the conversation. I'm sure, because mentors actually, they want to do what's best for you, right? So it will give them an opportunity to learn more and hence then respond more to you. So be brave enough to be honest in your communications with your boss, because that will then help you in doing the same with your patients in your consultations. And I did tell Kevin and Kim that I will actually bring them up here, because this is my current team, my physios, Kevin and Kim. I wouldn't have done this without their help. Like these, our sessions can be sometimes, they can run deep, I must say. And if they weren't on board, it would be hard for me to go on with the non-clinical side. So it's as much their effort as mine. So, when they started responding to my questions, I went ahead and I explored more and I learned more, and then I was able to teach more. So, okay. And finally, we've come to mistake number 5. Are you afraid to take the lead? Now, I'm not sure if experienced health professionals do this as well. Maybe they do, but it's just so important to actually begin with, I would like you to do this, or I want you to do this, rather than saying research says this, or research says that, or there's evidence for this. Because you know what? Patients actually don't care about research as long as you're providing them with value, right? The patient has trusted you enough to come there and let you guide them. Then your responsibility is to actually guide them, lead them by hand. And it's just so important here to actually even be assertive, like even, say, no, this is what I think, I think are the best results, or, this is the best way to achieve your results. And I'm sure the patient will come on board, because ultimately as humans, what do we want? We want to be cared for, right? And I really wanted to give an example of my GP. She calls me a VIP because of my very strong family history of cardiac issues. And, she's just so polite, yet she's firm with me. And she just says, like, you need to get certain tests done. She pretty much led me by hand. It was her opinion, not what the research said. And that's exactly what I do in my consults. I'm pretty firm with my patients. And, I do, of course, you have to show them that you care. This will only come out of genuine concern for the patient, okay? So it won't, if you're putting on a facade, look, patients will see through it. So this will come out of your connection with the patient, which will then trigger genuine care. And that's when you will feel, like you have an authority almost over that patient's treatment, okay? So yeah, that's what I think. And finally, that's my last slide. That's these are all the links where you can find me. Can I also plug in, Jade, that I'm actually looking for a physio at the moment. So anyone who's interested, please email us.
Recruiting on GRX Live. Why wouldn't you? There you go. And gosh, why wouldn't you want to go and work for an amazing mentor like yourself? You can. I just want to show everyone. This is all the notes that I have scribbled away.
Wow.
I love so much of what you said, but I think finishing off on that last point of being a VIP yourself, but we've got a duty of care to make each and every single one of our patients feel like they've got a VIP. At Western Region Health, we give out VIP cards. So, to get, and it comes like a little credit card, and our patients flash that and they get $5 off whatever their normal going consultation rate is. And geez, they love to flash that card. They feel very, very special. And there's certain ways that you kind of get that. You've sort of, have got to be a loyal patient at the clinic for a certain number of years, or, have different investments back into the clinic and back into the community. So there's so many ways around that. I think I've posted that previously, but making people feel special is so important. And it's, I think when it comes to that vulnerability and having somebody else make you feel like you matter. I'll never forget, for those who don't know my backstory, which I won't go into it, but I was diagnosed very early with a brain tumor when my daughter was about 10 hours old. And I'm obviously okay now. So that's not part of the
That's important.
But my obstetrician, she was absolutely beautiful. And obviously these things don't happen every day in her life in practice. I was certainly one of thankfully the uncommon cases that she saw, but she'd work with me very closely for 3 days, and I was handed over into the Royal Women's, and she mentioned to me that she had Friday off, and I remembered that. So she said, you won't see me Friday and Saturday. Friday and Saturday is kind of like my weekend, and then I'm on call again on Sunday. And I said, okay. And she said, you're in good hands, etc. And sure enough, I was in ICU and I'd had my surgery. And next minute was Friday afternoon, and my obstetrician walked in. And I turned and looked, and I said, hang on, isn't it your day off? And she said, I'm not here as your doctor. I'm here as a visitor. I want to see you. And I still, to this day, I mean, it was her day off. She was obviously still thinking about me. And that meant so much to me that I'm talking about that 7 years later. And through my leadership development work and the things that I do now and the courses that I teach, I know why. These memories light up our limbic part of our brain. And that's how people become memorable. And there's no reason why we can't do that as practitioners. And that goes back to your first point, which is a great segue. Did you see how I did that? Back to that first point of, or the second point, I think, in being personable. And we don't have to be, totally professional in the workplace. We are doing it all the time, and we do blur those lines, and we are a reflection of our personality. And we need to have that shine in the workplace. And I think one of the great quotes from Paul Wright, who was on the show a couple of months ago, he always starts every patient with, if you were my, meaning if you were my grandmother, if you were my father, if you were my brother, this is what I would do. So you tie in that personable aspect. My question to you, Garima, I guess when it comes to your mentoring is, you've got a lot of new graduates, and even whether you're a new graduate or whether you've been in practice for years, there are some people that just by nature, just within their DISC profile, in their psychometric profiling, they are very much fact over emotion. And that's them behaviorally. That's tied back to their environmental factors, the people that raised them, their schooling, their culture, often a lot of the time. What do you say to those people who do get anxious or feel unauthentic bringing emotion into the workplace? Obviously, this is something that we do need to practice over time. I've got somebody sitting here watching this saying, well, I just don't feel comfortable sharing my baggage and my story. We know that people want this, but what's the first step for them? Because obviously this comes over time. How would you advise somebody who says, I'm just not comfortable sharing my story with somebody who I personally don't think needs to hear it?
But you don't really have to, do you, Jade? Do you have to really go out and share your story? Or can you just connect with that person on a different, it's about connection, right? You don't necessarily have to go and spill the beans, so to speak, but this will go back to your relationship with your mentor. Have you practiced this? So if you're a new physio or a new grad, the way your mentor speaks to you is actually going to reflect in how you speak to your patients. And it's just because I've observed it, right? You know, even I mean, when you are a new graduate and you come out of uni, you have all these notions in your head of how you're supposed to be. So your mentor has a very important role in actually coaching you through it. Okay. And yes, people may have beliefs and this, but I do think beliefs can change. You can change as a person. You know, it's not a personality stamp, but it's just about opening up, right? I did speak about opening up your mind. That's how you're going to learn. You're not going to learn if you're in one streamline. And I just believe that. So, you know, it just, you know, if you came to interview with me, I would actually see how open you are. I have very, you know, specific set of questions that I would ask to figure that out.
And I think
So,
a lot of this ties, you know, there are some practitioners that are technically brilliant. As soon as they walk into the clinic and they build up these hands-on skills or these manual therapy skills or even their communication skills over time. But a lot of it, and I highlighted so much of it as you're talking, these common threads back to, you know, what I am so passionate about teaching and investing in and constantly needing to learn. You can't just assume emotional intelligence. It's broken down into 5
that's
categories.
it.
We've got, you know, self-awareness, self-regulation, empathy is there, motivation, and social
Yeah.
skills. And you mentioned them throughout the whole time. You know, you made reference to empathy, but also self-awareness, which ties me back to the question of
Yeah.
ego. When
Yeah.
you're dealing with some young professionals or a lot who have been out in practice for 20 years who formulate an ego through building knowledge, obviously it's, you know, there is a social perception that we can kind of see these types of personalities shining through, but without a self-awareness, a lot of people with bigger egos within the industry don't often know that they have it. It's not like somebody go, well, I've got an ego and I've got to work on that. Often the first step is self-awareness. So how
Recognizing
do
it.
you
Yeah.
deliver feedback if somebody
Yeah.
is, and I always suggest there's a fine line between cocky and confident. How do you deliver feedback when somebody maybe isn't opening their mind up and is less curious and
Yeah.
it has sort of stunted their learning in regards to that fixed mindset where they're not welcoming feedback from a mentor? How do you
Yeah.
navigate around that when you're mentoring?
Yeah. Yeah, it's not a one-off, Jade. So maybe like what I mean is it's not something that I'll go directly and just ask the person that, oh, you know, you seem to have an ego issue. It's not something that I do. So as part of my mentoring, I'd ease into it. I'd try to ask them, you know, personality questions. I'd like to know, you know, I don't have to know everything what's going on in their lives, but the way they interact with their friends, or, you know, if we were chatting about something and they were to give me their opinion about that, that will help me understand. So it's a lot of introspection, but it's a lot of analysis of, okay, well, they came up, so in this meeting they've said something that they didn't like. I won't just blurt out my response. I would actually think about it and say, okay, well, if this is the case, how are they behaving in their personal life? Is there an example there that might give me a bit more information about what could be a barrier here that's actually reflecting in their consultations with the patient? Because ultimately the consultation, you know, you're one-on-one with the patient, right? It's still about that that relationship between you and the patient. So just by knowing how they would react or how they would be in a situation outside of work will give me an insight into their personality. And then I would be able to just say, oh, okay, well, have you considered this? Do you think this could be an issue? It's not about me telling them. It's about me helping them to be more aware. Like you said, it's me, you know, it's about my helping them to get more self-awareness that, okay, this might be reflecting this way. And this is what the patient might be perceiving.
Yeah, and I totally agree. I guess when it comes to that feedback, as I always say, offering feedback without meaningful advice is just criticism. So,
Yeah.
you know, and often you do have to sit back and digest what's happening. And otherwise it's an opinion point, isn't it? And you're forming some bias of somebody before, I guess you've seen them in that workplace. But I do think as mentors that sometimes those conversations can be difficult ones, but I guess that's your role as a mentor.
But
Now,
I think, oh, sorry, Jade.
no, go ahead.
I think listening more than talking, obviously, would give you a lot more, but asking the right questions as well. So you as a mentor need to learn, I suppose, need to apply your leadership skills and take your course to understand that, but they need to go through that themselves in order to then be in a position to deliver that to their team, right?
Yeah, absolutely. Now, one of the other things that you mentioned, which I love because I'm so passionate about it, but I feel like the pendulum has swung too far. And again, I'm already setting this up with some bias. And that's this notion of patient-centered care.
Mm-hmm.
You know, this is very front of mind at the moment. Whereas for me, somebody who's been in practice for 20 years, haven't we always been patient-centered? Isn't this what this is all about? Shouldn't we be putting the patient first and not the condition? I mean, a lot of these things to me just sound like a no-brainer. The fact that we even have to have these conversations, I think somewhere, where did we get to this point where people are not doing this? But often we do, we see good and bad in every single profession. But you made the comment, which I love, which is where you need to guide and lead the patient. And I totally agree. Some patients need that consultation taken by the balls. And literally, they're coming into you asking for your advice, asking to hear your feedback based upon their experience, and asking you to lead and, you know, inspire a shared vision and making sure that you're talking about, you know, combined goals and plans and results and the best outcome, the best treatment plan for the best outcome for that patient.
Yeah.
But when it comes to this patient-centered care, all that is around patient-centered, but there's also this focus at the moment that the patient gets to decide their pace, but often you don't know what you don't know.
Yeah.
So at that point, now that does come down to a lot of experience, knowing when to interject and offer that practitioner directed and say, hey, I've seen this before and I know better, without having that ego attached to it, because sometimes patients just don't know. When you are mentoring that, and that comes from a lot of experience, it's really difficult for mentors to be able to, but I do think that too early on, if we're very focused, and I'd love to hear your thoughts on this, if we start to focus too much on the patient-centered care and constantly talking, sometimes are we missing some of that practitioner direction, which is really important early on?
Yeah. Again, so I think it just, I've lost you there, Jade. I think you'll have to repeat because I was thinking about something and you'll have to repeat your question to me.
That's partly my fault because I think I am passionate about it. And I think maybe perhaps I did that very badly in that I pitched the statement as a question. Did you see how I did that? So, and again, obviously when you're offering an opinion on this, then equally you deserve to sort of get opinions back. But I do think, you know, my question to you is, what would be your definition of patient-centered care?
Okay, patient-centered care. Yes, I agree that it has been, you know, it's been pushed to the extreme, like, oh, everything revolves around the patient too. But you've got to lead, right? Like you've gone to uni for 4 years. You've got some sort of, you've got an idea based on whatever you've learned. You've got an idea about how this would, you know, how this would play out or what this looks like. I think, yes, you're right. It does require experience. It's not something that, you know, you'll just learn and you'll be able to apply. After seeing and talking to so many patients over the years, then you start understanding, okay, this kind of patient might present this way. And then what would be my role would be actually to either, you know, very politely steer them in the other direction, although I do believe that patients know what they need, they may not be able to tell you exactly in words. Okay. And again, this might take experience to just figure out, okay, well, will this patient listen to will listen to my advice if I say it very specifically, or will it just be, it'll take me a little bit of time to develop a relationship and then sort of, leading the patient that way? I hope that's answered your question in a roundabout way.
I think it is. I think it's such a subjective question. So I was kind of throwing you to the wolves there a little bit, because it's really hard to objectify and it's really hard to get. But I think one of the difficulties is, and the reason why over time with over experience, is there's so many different patients, and wearing a different hat all the time and being able to be totally adaptable to the person that's in front of you. We know when we do, and that's part of the reason why I went back and did psychometric profiling, certain patients need certain direction. You've got your D-style personalities. They just want their fast pace. They want to be told what to do. Here's the plan, execute, do these exercises.
Oh, that's true. Yeah.
And then you've got the I-style personalities who just want that optimism, that everything's going to be okay. And they want that positive, constant support. Then you've got the more S-style personalities who want you to listen and sit back and want to feel heard without you kind of jumping in. And then you've got the C-style personalities who want all the facts, the figures, and the evidence. So, it does become really, really hard, because to me, that definition of patient-centered care is delivering every single patient exactly what they need. And that is really hard without understanding elements of behavioral and social psychology, which we don't learn.
No.
And so,
but do you think you can actually teach that to new grads, or do you think that will come with experience? Because this disc profiling, I could do my own disc profiling of the patients over the last 15 years of seeing people, right? So not necessarily I've profiled every patient, but it's with experience that I can tell that this kind of patient will react this way. But do you think you can teach a new grad?
Look, you can definitely teach the concepts of disc profiling. It's part of the foundations of the course. For those people who don't have the experience, you have to at least start somewhere. And I guess that ties into my next question for you is intuition. You're obviously so eloquent when you speak and engaging, and patients, I can see why patients build trust with you quickly. I'd love to know, were you always like this? Like, I know you've done a lot of professional work, but in your personality, and this is where I want to define, and I do ask the hard-hitting questions, where I certainly do believe that there is 30% of what we do that is tied to our personality that I believe you can't teach. And that's a very blunt and that's a very bold statement to make. But there are some practitioners, I believe, and I'm just going to stick with me, that will always be more successful in a service-driven healthcare industry purely by nature.
Right. Okay. I think I disagree with you there, Jade. I know I've heard you speak about this actually in one of your interviews. I think it was with James Schomburg. And I just, I thought, if you had asked me this 10 years ago, I was a different personality. I had huge ego. I was a different leader. I was a different kind of leader too, because, I come from India, which is highly competitive. So many people, right? So my mindset, and people have to work hard. Like, if you quit your job, there are hundreds of applicants for your job. So my mentality was different as a leader. I read through it. And I never wanted to be, I thought I was a shy person. I don't think so anymore. I thought I didn't want to be a speaker. I thought I didn't want to be a teacher. And yet these are the things that I'm passionate about. So this has obviously helped me. This has been a huge personal growth journey. So I do think, yes, there could be certain traits, but there's a vision of something. I think it can be learned. Yeah, you've just got to have passion and vision for it, actually.
I do definitely. I think that leaders can be made, absolutely, or I would be without a job in leadership development, absolutely. But I think it's more that I do feel like there are certain personalities that are more engaging, charismatic, where people want to be around them. And therefore, I do think, and there's also, not everyone resonates with each other. I think it's more about finding your tribe and your patient base that suits you. Yeah. So I'm not suggesting one for all. I'm suggesting that you need to find your target patient audience. And that's my point when I talk about a lot about this, is that you need to understand with self-awareness what type of patients that you want to see, that you're going to resonate with and build connections with faster. Those fact, hard hitting, science based, I need all the detail, are probably not going to like me as a practitioner, because I am all inspiring and positive and you know, could be overly optimistic. And there are some patients that are like, just give me the facts. So I think you need to find your tribe of patients. And I think if you start to do that from a really young age, work out the type of patients that you love seeing, that's going to tie back in to your point before. And that is that job satisfaction. And that includes a boss. So my question to you is, when it comes to job satisfaction, what if, yes, I totally agree with you, having that relationship with your boss is going to make you much, much happier in the workplace, considering you're going to be working together all the time. What if you don't have a great relationship with your mentor, but you financially need that role and you've invested and you love your patients? What happens there? If that's one of your top 5 mistakes, I mean, it's for you, I can imagine it's quite easy because you're very much loved, and your team, I can see where that value comes from. But unfortunately, not all business owners are going to have those relationships.
I have to be blunt here. You find the person that you connect with. You find the job that's best for you. Because ultimately, like how long do you think you can stick with a job that you're unhappy in, you know? And people still do, but they're not serving their people, right? They're not. If your ultimate goal, if you became a health professional to serve people, you're not going to be happy doing that if your relationships, if your environment is not allowing you to do that. So bluntly, you need to move on, and you find the person whom you resonate with, you find a practice that you resonate with, and it takes courage. It's not easy, definitely not easy, but who said life was easy, right?
That's right. And the reality is that a lot of the time, the clinic owner or the business owner's core values are tied in with the philosophies of how you treat and how you manage patients and their overall experience. So I think you're absolutely right. It would be really hard if your personal and professional mission statement didn't align with that of your workplace. You're going to soon end up quite unhappy.
I think it begins in the interview process. Like if you as a business owner have questions related to personality of your business and the kind of patients you would like to treat, you just need to ascertain whether the personality of the interviewee matches with that, right? So it all begins in the interview process, even before you start working for someone. So
for those mentors out there who are wanting to, and I like to call it normalize emotion in the workplace, start talking about it more and start sharing more, because obviously we do want to build trust faster, and the quicker that we can build those connections and trust, the better outcomes we're going to have. As you said, it's sort of all tied back. What's one of the first non-clinical tutorials that a clinic owner could have with their team?
Tutorials. Wow. Okay.
Like if you were setting aside an hour.
What would I do? Would you
talk about a case in particular, or would you actually sort of talk about, build on these 5 common mistakes? What if you had an hour with your team that was non-clinical, where would you start?
It wouldn't happen with the team, first of all. It's not something for a team setting to begin with. So if you've got a new, let's say a new person joins your team, expecting them to pour their hearts out to you in their first session, not going to happen, right? So even just a goals sheet of their desires, of where they see themselves, what's their vision for their life, for the 1 year, for 3 years, for 10 years, I'm not sure, just depends upon your practice. But just to get an idea of what are they expecting from this job in terms of money, in terms of what would they like to achieve? Like what does job satisfaction look like to them? What does a great job look like to them? You could even ask them, I suppose that will take a bit of time to ask them a little bit more about their relationships, but you can always ask them, well, what about your siblings? Where's your family? Where are you from? If they are an international person. So it just doesn't begin on day one with, going deep. You do have to you do have to start with what's their vision from, like, how can I help you achieve what you envision for your life in the next 2 years? I think that's where it starts.
And, you know, that concept that you said at the very beginning, that quote is offering time with them, but to be able to provide them with value. If you want them to be open and vulnerable with you, you have to start building that relationship. And it all ties back. I mean, that's my 6th category in emotional intelligence, is relationship management. And that just starts by spending time with people and having a genuine care and concern for them and their well-being, what they love, what they want for the future. So we do, you know, we've got a really similar and very, very valuable feedback survey as part of the V-score that we do with our team, which asks them simple things like, you know, what are your goals, or, you know, what motivates you most, or what do you love most about the workplace? What are you most grateful for in the last week in the workplace? Do you feel valued and heard by your managers and mentors? What was the last positive thing you contributed personally to the workplace? We've got so many questions like that, and that does help to start build those connections. So I couldn't agree with you more with asking, you know, in the question. And then, as you said,
oh yes, sorry, Jade. We do begin our team meetings with, you know, a personal thing that they're grateful for the week, and a professional thing. So, you know, if someone's grateful for something in the past week, that again opens up doors, you know, into their personality as well. So people can share as much or as little as they like, but that still gives us a bit more information about their personality and their personal lives. Yeah.
And one of the bold statements I make in my Good to Great course is, the type of person you are is the type of practitioner you will be. So if you want to get to know somebody, then you're also getting to know what they're like in the consultation room, because it's very, very hard to be inconsistent and be one person outside the consult room and one another. I've certainly seen it over the years where people totally change from one person to another, but over time it's hard work. Being somebody different, wearing a different hat. It actually takes effort to change who you are. So, which comes back to that point too. I couldn't agree more, is that there is a blurring of your personal and professional life. And I think as soon as we realize the importance of that and own it, then the beauty will start to come, and those outcomes and all of those patients, which all ties back again to the very first thing that you said, which is service. You know, ultimately, you know, even if we're not present, often the person in front of us certainly is. And we want to be memorable. We want to light up their limbic part of their brain, and we want to make them feel like a VIP client. So there are so many takeaways from today, Garima. You know, even I personally work in this space so often, but it's really nice to hear other very credible people. And vulnerability humanizes authority. And I think you've done that beautifully today by sharing all of those personal accounts and experiences, because that's what makes credible people personable, and that's what makes people want to come to you. So hopefully we can find you a new physio.
Yes. Here's hoping.
but I do love all those takeaway messages, and I do understand. I definitely empathize with those practitioners that find it a little bit more, or start to see it as sort of unprofessional when you start to blur that line. But I swear, for so many years I had patients coming in to see me just to hear whether I was still single or whether I'd found my husband or not. I was single for 9 years. And I think it was very hard to hide.
Oh gosh.
But after a while it gets really hard. It takes a lot of effort to be somebody that you're not. So I think the takeaway for me here, and having listened to everything that you said, is just be authentic.
Be you.
Be yourself. So for those people who do, obviously you can tie this into clinics with some mentoring. If people do want to find you, I think your details flashed up before, but can you tell us your details again so that people listening can find you at home?
Yes, sure. So my email address is just info@getbetterphysiotherapy.com.au. And anyone who wants to apply can send us their cover letter and resume there. Now, with my Facebook and Insta, I actually don't remember the exact links. So I'll just have to put it up.
We'll put that in the comments for everyone. But thank you so much. And thank you for your time. All of our guests, and particularly yourself this week, we put so much time and love and passion into those slides to help educate other people. You certainly don't get paid for this. So I'm very, very grateful for your time and for your message, which is leaving a legacy behind, which is what you want. Practitioners like yourself who are delivering these messages and helping to facilitate the growth of other people is really, really rewarding for you. And now it's just an additional hat that you wear when it comes to serving, not only serving patients, but serving the greater allied health community. So thank you so much, Garima. Thank you, Garima.
Thank you so much, Jade. I really appreciate it.
My pleasure. Thanks, everybody. Thanks for watching. We'll see you soon.
Bye-bye.